Now, there's a number of practical issues that come up, and I want to go through some of these practical issues of cooling because we'll inform some of our subsequent discussion. I want to give you a flavor for how we deal with this and how we think about it. Well, when patients are cooled, one question that comes up all the time by healthcare providers is how to cool. What are the methods we should use to cool patients? Another key question that always comes up is when to cool. You might imagine that you need to start cooling soon. After all, I shared with you the laboratory studies that showed that inflammation and mitochondrial problems and reactive oxygen species, these problems start right away. They start very soon. So you got to cool as soon as you can. We generally believe you need to start cooling within a few hours of arrest. So God forbid if one of your loved ones has a cardiac arrest and is resuscitated, God forbid they wait to cool till the next day. You really got to start cooling right away. Now, another question, of course, is how deep to cool. We generally believe between 32 and 34 degrees is the appropriate therapeutic target temperature based on those studies I shared with you. And then finally, how long to keep cool is an active question. If you recall, one study used 12 hours of cooling, another 24. So there's a lot of questions still that remain to be figured out about how to use hypothermia in practice. Each hospital tends to develop their own protocol, and there's a lot of different flavors of the way this therapy is implemented. And much more work needs to be done to bring our understanding to a unity. Now, I want to share with you a little bit about our initial experiences. When I started using hypothermia, I trained at the University of Chicago hospitals, and we started cooling as far back as 2003. Back then, there were not good tools to cool, meaning there wasn't a technology that we could use to steadily and reproducibly cool patients. So we did what we could do. We packed people in ice. It's what we had. Now, packing patients in ice, it's cheap. Every hospital has ice machines. And it's non-invasive. We're not sticking specialized equipment into patients to cool them. But there are some serious disadvantages with packing in ice, and we experienced this firsthand. It was messy. There were puddles on the floor, and patients